Hello, thank you for joining us for this presentation on licensure of International Board Certified Lactation Consultants and Government Relations Strategy. My name is Judy Gutowski, and I'm Chair of the Licensure and Reimbursement Committee for the United States Lactation Consultant Association. Here's my contact information if you'd like to speak with me or contact me after this presentation. USLCA is an affiliate of ILCA, the International Lactation Consultant Association. As such, we are dedicated to issues concerning specifically the United States lactation consultants and the families that we serve. Because ILCA is more devoted to global issues, USLCA has the opportunity to focus more on just what is important to the United States and our healthcare system. The goals of USLCA are for IBCLCs to become an integral part of maternal and child health care teams. Whether an IBCLC is working in a hospital, home health, clinic, or private practice, or a physician practice, she needs to be able to be involved in the care of mothers and babies throughout the course of lactation, so that all of the barriers a mother might encounter, she is able to be there to help her overcome. Additionally, we want women to be able to get the services of IBCLCs and get them when they need them. Lactation support that's provided too late is often too late to save breastfeeding as well. So we want to be able to be timely so that lactation can continue. Lastly, we want our IBCLCs to be able to be paid for their work. Historically, licensure efforts have been ongoing through the Lactation Consultant Association since 1997, beginning in Texas. In 2005, ILCA formed a task force that took an in-depth look at the issues of licensure and reimbursement for the first time. And shortly after, USLCA was formed in 2006. USLCA, therefore, has been enabled to put significant time and resources into studying and advocating for licensure and reimbursement for IBCLCs within the healthcare system that we have. Our committee was formed in 2009, and over this past 5 years, we have learned a great deal studying the issue. We have written and advocated for licensure bills and had some introduced in states, and we've also been involved in promoting reimbursement strategies in the public health administrations and with insurers, both public and private, since then. Our first insurer to credential IBCLCs was in 2012, and that was Aetna. And our first state to license IBCLCs happened just this past July, and that was Rhode Island. This map will show you all the stars, which includes 31 states that have activities related to licensure ongoing. All of these states have committees that are operating. Some of them are just at the level of starting to entertain the idea, and other ones have gone as far as already had their legislation introduced. We probably are looking at about 5 states that should be able to pass legislation in the coming year. Breastfeeding support, as you know, is an investment in the lifelong health of mothers and babies, and it is a national health priority, with many government organizations calling for breastfeeding support to be made available to mothers, and our health professional associations recommending breastfeeding and recommending that mothers receive care so that they can achieve the breastfeeding goals they desire. Research-based evidence shows that women and children are more likely to begin and to continue breastfeeding if they have access to an international board certified lactation consultant. And this is our message, very simply, that we want to share with everyone so that they understand the need for the care we provide. Other healthcare support providers are limited in supporting breastfeeding. This includes all the disciplines of other types of licensed healthcare professionals, such as nurses, nutritionists, pharmacists, and physicians. Though the public and other health authorities expect them to be able to provide lactation care, they really have not been trained in the core knowledge that they need or the skills they need to manage breastfeeding and breastfeeding problems. Unfortunately, because the healthcare professional breastfeeding knowledge is not there, this is impacting the quality of breastfeeding services women receive, and it's certainly impacting our breastfeeding outcomes. And this is part of the reason that breastfeeding duration rates have not climbed as we would like them to in the United States. So USLCA recommends healthcare system change. This includes state licensure of international board certified lactation consultants. And what state licensure will do is it will provide the public and all the authorities and other healthcare professionals, the people who need to know, with a standardized and proven qualification for a professional who can help mothers to overcome their breastfeeding barriers and succeed in breastfeeding their children. Additionally, with licensure, it enables affordable, convenient, and timely access to care for all women and babies. The reason is because licensure is imperative to the infrastructure that allows third-party reimbursement. For Medicaid in particular, there are regulations that prohibit any reimbursement of non-licensed providers. So if we want to provide services for Medicaid mothers who now, because they do not have money to pay out of pocket for care, we're going to have to be licensed. Additionally, private insurers and employer-funded insurers generally follow the models of Medicaid, and they follow the Medicaid regulations. Even though they're not legally restricted to that, that's what they do. So they are not, in most cases, other than Aetna and a few other smaller groups around the country, they have not universally embraced credentialing of IBCLCs, which is what needs to happen. The process for states is, first of all, to form a dedicated committee to study the issue of licensure and to advocate for it. Ideally, if you can, it would be good to obtain services of a skilled government relations representative. These are people who have connections and have knowledge of the political workings within their state. And they're able to guide you very well along in these processes and can save you a lot of time. We have them, otherwise also known as lobbyists, working in several states. Some of them work pro bono and some of them are paid, and this has been found to be very helpful. Next, you would want to be able to seek out the legislative sponsors for your licensure bill. And these may be people that you already know, people who are sympathetic to breastfeeding, and people who just live near you if you don't already know your legislators. You will consider people who are interested in things that are related to breastfeeding, such as healthcare, professional licensure, women's issues, and children's advocates. And you'll also then want to, once you have your legislators who are willing to sponsor a bill for you, go out and do the networking to get grassroots support throughout your state. So this is a process of advocacy and education. And obviously you will start out targeting the people with the power to create change, beginning with your legislators, but also local civic leaders, government and public health officials, your medical professional organizations such as the AAP, ACOG chapters, nurse practitioners, nursing associations, your insurers, private and public in the state, researchers, volunteers such as Low-Latency League, and other community activists. All of these people can help you to get your goals put in front of the legislature and get the bill passed. You'll also want to seek out other potential collaborators who would be willing to write letters, testify at public hearings, give you letters of support, sign on to petitions, and help just create awareness in general of your issue. And these would be people in public health, maternal and child health, or family advocates. They don't have to just be in breastfeeding. Right now, particularly, obesity is a big issue, so that would be helpful to have people who are involved in obesity initiatives, nutrition, healthcare prevention, those involved in special needs such as autism, safe childbirth practices, midwives would be part of those. Healthy Mothers, Healthy Babies groups and March of Dimes commonly would be helpful in breastfeeding advocacy, and those involved in mental health or abuse prevention. For your model legislation, there are going to be a few important points to include. First of all, you'll need to have an existing board to accommodate the IBCLC in most states, because we generally have about 400 IBCLCs in a state. That is not enough in number to financially sustain an independent board. Some states have an allied health care board, and that would be an ideal place to accommodate the IBCLC. If not, you would want to begin talking with some of the other boards operating in your state, physicians, nurses, therapists, whoever would be interested in administering the IBCLC license. If you can't get collaboration from a group that you talk with on your own, you can also rely on your legislators or your State Department, depending on how licensure is administered in your state, and see what they can recommend. Secondly, you're always going to want to be sure that the requirement for licensure is the IBCLC credential. This is important because when that is written into the language of the bill, no additional exam would be required, making it much less costly for the state and for the individual. And the IBCLC certification itself serves as the requirement to be licensed. Also, IBCLCE has a number of legal professional documents in place that are useful in defining the credential and the qualifications and the scope of practice, code of conduct, which will be helpful to your state governing agencies to consider. Third, you'll want to have an exemption clause in there so that healthcare professionals who are already providing lactation support in their normal daily role as a licensed provider, such as nurses and physicians, are able to continue doing so and don't have to be holding a second license as an IBCLC. And also for your volunteers, such as Little Leachy League and other maybe peer type of support groups and organizations, we don't want them to have to qualify for and pay for a license to provide that level of basic breastfeeding support. When the model legislation is written and the IBCLC credential is the defined requirement, this would mean then that your state and your IBCLCE discipline could be enforced for any IBCLC separately or together. And that in the state, they would provide penalties for unlicensed practice, where IBCLCE may take away the title, but they don't have other outside penalties. Lastly, you would want to try and include language for state reciprocity so that when we get the IBCLC license in a variety of states around the country, if you move from one state to another, your license would be able to be transferred. Some of the common challenges we have found with licensure include that authorities with the power to effect change are not aware of the IBCLC profession or the mother's need for the care that we provide. So this is something that goes back to the education and advocacy. They just don't know about us. They don't know what we do, and we have to teach them. Additionally, there's a lot of confusion about various levels of breastfeeding support providers and why mothers need the different levels. They don't understand what we do that's different from people who have a different set of initials or different levels of training. So we're going to need to provide that information for them. And this is outlined very clearly in a document that I'm going to talk to you about next. Lastly, many states have just made arbitrary decisions not to license any new profession. The goal for this kind of political notion is that licensure restricts ability to trade for certain professionals, and that may be the case for some of them, but in the case of IBCLCs, it prohibits pretty much everyone from ability to work in the field because we are effectively shut out of the healthcare systems in our country that operate based on licensure. This booklet, which you can access on the website noted here in the title bar, or you can request hard copies if you like from our executive director. It's called Containing Healthcare Costs, Hope in Plain Sight. And it's a compilation of all of the information and evidence that you need to know as an advocate and an educator on licensure and reimbursement of IBCLCs. There are hundreds of references. Everything is documented with all of the evidence that you need. And we would like you to please take advantage of the large efforts that go into creating this piece of research. And you will be able to use it to educate yourselves so that when you go out and speak on behalf of IBCLCs, you know everything you need to know and to share with the people that you're going to be talking with. We've also provided you a single-page handout, which is a really brief summary of this today, and you should have it in your packets. Lastly, the USLCA is committed to serving the unique needs of families and the members who are IBCLCs in the United States, and we need your help and support. We're glad to have you on board. Thank you very much for your time.